Hi, I'm Emma Mawby, and I'm one of the two public volunteer governors for Gloucester. My background is about 15 years in industry, and then I moved into consultancy and worked all over the world. I've been a volunteer public governor now for just over a year. So, what drew me to the role? I think a big desire to see patients getting diagnosed earlier. Early diagnosis of medical conditions is really important to me. And I want to see our hospitals trust become a place that recruits, develops, and retains the very best talent that we can in every job, in every area, always. And the midterm focus I have is about really starting to make sure that we get more of our services into Gloucestershire. And I think medium term as well, there's something for me about some very specific medical conditions that we really need to be working on earlier diagnosis and treatment for, again in county. And so that would be things like endometriosis, adenomyosis, gender dysphoria, assisted conception for women in same-sex couples, and for things like disordered eating and for young people's mental health. Those things we need to have early diagnosis, proper support, and we need to have those services in Gloucestershire where we can access them in a timely fashion. So what have some of the highlights been of my first year? I think the most important has been listening to patients, whether that's here in the Hospitals Trust or one-on-one out in the community or on the NHS community outreach bus and events. And that bit about patients sharing their stories, sharing their experiences, so we can bring that back into the Hospitals Trust and work with it to make care better is really, really important to me. And then the other bit is listening to staff and seeing where they work and how they work and what they do. Because the more you see of them, you realise what extraordinary people we have in the Hospitals Trust. But you also realise that the NHS is our people, and that's why recruiting the right people, developing in them and training them and supporting them and making this a place they love to come to work and want to come and work in is so vital for our future. So, how can we help the Hospitals Trust? Talk. It's a really important thing. It sounds really simple, but it's vital. So talk to us at the Hospitals Trust, either one-on-one or while you're in the Trust itself or at the NHS community outreach events. Share your experiences, share your learning, share your ideas, share it so that we know your story and we know what we're good at and what we need to change. And similarly, talk to our patient advisory and liaison service team. They're the most incredible group of people in our trust, and their job is absolutely to listen to you. And then finally, you, I, our families, our parents, our grandparents, our great-grandparents, we chose, we created the NHS back in 1948 because we wanted all of us, everyone, all the time to have better healthcare. And I look back on that generation in 1948 that chose to create this amazing, amazing space, these people, these teams, this healthcare. And I look at them and I think they did something amazing for us and for our country. And then I look at all the space I'm in and all the people I listen to and work with, and I go, and now it's our turn. So it's our turn to do our bit. So please do join us as a public member of the Trust. It's free. And your opinions, your views, your experiences is what will shape our healthcare going forward. So your voice is vital to the NHS. So please support us, please get involved, and you will be the person who makes the difference in Gloucestershire for you, for me, for your family, for mine, for all of us. Thank you.